with the president expected to meet the National Security Council later in the week to make a decision. Now, the Council of Governors Chairman Wycliffe Oparanya said counties are getting overwhelmed with virus cases after the country officially crossed over into the second wave phase. Now, the country is currently under 11 p.m. to 4 a.m. curfew without any lockdown after the president reviewed stricter measures initially imposed to curb COVID-19. Now, as the president meets governors, I want us to talk to Andrew Mulwa, who is the chair of the health CECs here in the country. And Daktari, thank you so much for talking to us here on KTN News Center. So why is the spike in numbers in the counties?
Thank you, Brenda. We must appreciate that, one, as a country, we are facing a second wave of COVID-19 infections. And the reasons why we are seeing a spike in numbers is multifactorial. Of course, there are several things that are working against our earlier response. I think generally after first 6 months of sustained restrictions and containment of the pandemic, and having gone through the peak in August, September, I think everyone went into a celebration mood. And with the reopening of the economy, a lot of activities in terms of businesses, in terms of social places, in terms of gatherings, people actually thought His Excellency the President and the Ministry of Health had opened up the economy as a result of a win on the war against COVID-19. Far from it, of course, we are now seeing the effects of that. We have seen heightened political activities. We have seen the reopening of schools. We have seen reopening of religious places. And all these factors compounded are accounting for the second wave, which seems in terms of infectivity rate and in terms of the numbers, sheer numbers that we are getting in terms of both morbidity and mortality seem to be pretty higher compared to what we had between period of between March and September this year.
So, Daktari, if I got you right, you're telling us that we got here in terms of the second wave due to laxity of adhering to the containment measures.
Yes, I would confidently say so, that we lost the discipline that we had trained ourselves, that we had given ourselves during the first phase, and that accounts for the spiking numbers in this second wave. Right. And the other thing is with the opening of economy, of course, when in the first phase, when we had this COVID disease, we could actually say we only had a severe epidemic in 5 or so counties. Now with the opening up of transport, restrictions for movement removed, many persons moved from one part of the country to another. So you can literally say that the current phase is no longer focused on a few counties, but is more of a global. Of course, there are some counties that are affected more than others. And of course, in every county, you can point to explanation. You can point to scientific correlation why the spike in certain areas, of course.
All right. So, Daktari, the president goes ahead to open the economy, the country, in terms of lifting the, extending the curfew, reducing the curfew hours, and of course, opening the inter-county migration. But then later on, we are seeing political gatherings. Can we confidently say that politicians are to blame for these surging numbers?
Maybe I would say yes, not to blame. I would not use the word to blame, but I would say yes, they account for a significant number of the new cases in terms of these large political gatherings that we are seeing are, of course, centers for spread of the infection, and they are counterproductive to any COVID-19 containment measures that we have put across. Of course, the issue of political leadership and leading by example and being role models also comes in very strongly, that we have seen a lot of our political leaders address crowds without putting on masks. We have seen a lot of political leaders shaking hands with citizens, and it becomes practically impossible to now go to the citizen and tell them, don't shake hands, when they have seen their leader shaking hands. When they have seen their leader addressing crowds without masks, we tell them don't have gatherings of more than 200 people. When they have seen their leader addressing people in their thousands. So sometimes, I think we can actually say, yes, the political activities in the country have contributed significantly to the rise of COVID-19 cases in the country.
All right. And so, you know, every day when we listen to officials from the Ministry of Health, the CS for Health, the CAS, the PS for Health, addressing the nation in terms of our numbers, then it begs the question as to whether the country is doing enough when it comes to mass testing and contact tracing.
I think we all appreciate that we are working in a very strained environment in terms of the resources, in terms of the testing capacity, in terms of the test kits that are available in the country, because aware that this is a global phenomenon and the logistics chain, as much as we would like to test the 47 million Kenyans in one go, we do not have the test kits to 47 million Kenyans in one go, because there have been disruption in the procurement chain. The global demand for these test kits is very high, and we cannot possibly, as a country, have all what we want. But I would say that what we have been doing as targeted mass testing has continued to work for us as a country, because currently we have tested more than close to 700,000 cases in the 7 months or so that we have been testing, which compared to the rest of the African countries is pretty good in terms of the sheer numbers that we have done. What we are doing is targeted testing. There must be an index of suspicion. You need to do community surveillance. There must be a reason why you go testing. We do not possibly have resources to tell all the people in Makueni, for example, where I come from, the million people, we are testing all of you. If, as a government, we would say we want to do 100% testing, we would be lying to the people, because the resources are first not available, and what we are doing is targeted testing, which has really worked for this country, because as I had mentioned, in the 6 months, we were able to use that and contain. And even this second wave that we are seeing, it is as a result of that targeted testing giving us the numbers that we are getting, because you have to have an index of suspicion, you have to, so therefore as you test, you expect a higher positivity rate rather than go and test a population that has no risk at all.
Right. So, Daktari, you know, when you talk about mass testing, everyone is looking at the national government. So talk to us about, you know, you're the chair of the health CECs. Talk to us about county governments being given that responsibility of testing, because there's some counties we know they have to take the samples they collect to the testing centers that have been set up by the government.
Of course, and we must appreciate where we've come from as a country, so that you also understand where we've come from. I think in March 12th, when we got our first case, only 2 labs in this country would test for COVID-19. The National Laboratory Lab in KNH and the Kemri Lab in Nairobi. Those were the only 2 labs that could test. As at this minute, about 33 or so labs are able to test. So to imagine that we would have all the counties have testing capacity in the immediate, it would be a pipe dream. But what we have done, we have built the capacity of the counties to be able to first collect the sample, because the issue, the whole issue begins with collection of the sample. Then the samples are taken to the labs where the actual testing is done. Then the results are relayed back to the counties. We have a system, and the counties have been divided into clusters. So therefore, counties around the eastern province, the lower east, southeastern part of the region, which is Ukambani region, we are using Machakos and the Kemri Lab in Nairobi. For counties around Kajiado, we are using Nairobi. Kiambu and counties around Nairobi, they are using Kapu. So the country has been divided into clusters, and these clusters, I think, when all factors are held constant, the turnaround times and the logistics chain in terms of having the sample, the turnaround time between the time that sample is collected and delivered to the test lab and the time we get results has been working perfectly. I think there are circumstances that within 24 hours, we already have results.
So
that may not...
So I just to shift our focus to schools reopening question, because schools were reopened last month. It's barely a month since they were reopened. Cases of COVID-19 being reported in schools.
Yes, I think that was one unexpected phenomenon. And when schools were reopening, there was that consideration, and that's why the government thought about phased reopening of schools, so that we may learn. Because like we keep saying that no one actually knows this disease fully, and we are learning, and therefore we have to learn. The school system must learn how to deal with COVID-19 cases. Then when you identify a positive case in a school, do you close the whole school? Do you identify the contacts of the positive case and contain them, isolate them, and quarantine the contacts? Or what should be happening? This is a learning phase, and that's exactly what we are happening, because schools are gathering, students, pupils are coming from all over, teachers are coming from all over. They are members of a community, so we expect them we expect to have positive cases. But having learned much about the disease, first in the young people, the outcomes are better. Most of the children will be asymptomatic, and therefore having learned that, it's now teaching the education sector, learning how to manage the cases going forward in terms of how do we manage the positive cases that come through in the education sector, which I think we have done very well. I think the option of closing schools or not should not be a question that we need to consider at this time, because ultimately COVID-19 will be endemic in our region, in our country, and therefore we will need to continue dealing with the disease, and we have to learn how to live with the disease as an important management of the pandemic, because we are not whether we will be able to get a vaccine or we'll be able to get over the disease in the next month, year or so. So we are learning how to do it. And the phased reopening of schools is one of the ways that as a country, as a region, we are learning.
Right. So, Dr. I know, the education sector is still a function of the national government, except the early education childhood, which is still under the counties. But what are the CECs of health in counties doing to ensure that, as much as this is a function of the national government, there's a role that they are playing in ensuring that all students, pupils and teachers who've gone back to school are safe, or at any time a case is reported, on how the counties can handle it?
First, we are working very, very closely with the national government in terms of the whole spectrum of COVID-19 response. At the county level, we have what is called the County Emergency Response Committee that has both membership from the county, led by the county governor and the county commissioner, and members of the county executive from, and as well as the heads of departments from relevant departments in the national ministry. That platform ensures a full coordination of business between the county government, where health is devolved and education is not. So we are able to constantly keep engaging. Below the county level, the sub-county levels have also a similar structure, and below the sub-county level, there is a similar structure at the ward level. This ensures that if there is a suspected case within a school, the health team, which is a devolved function, is able to get mobilized. We are able to do surveillance, we are able to do testing, we are able to do isolation and quarantine as is appropriate. So there's a seamless mechanism that has been established that ensures there is a constant coordination between the national and the county government.
All right, thank you so much. At that point, I'd like to say asante sana, Dr. Andrew Mulwa, who is the chair of the Health CEC, is talking to us about the reopening of the country and also schools, and also whether the politicians are to be blamed for the surging numbers because of the public gatherings that have been witnessed. Remember, early this year, actually mid-August, the Health CS, that is Mutahi Kagwe, say that if the numbers continue to go high, political leaders are to be blamed for that. That is the same statement that the president echoed some time back at the KICC during the Governors Summit on COVID-19. But then my colleague Emmanuel To is in the streets of Nairobi talking to residents on the surging COVID numbers. Emmanuel To, talk to us about what the residents of Nairobi are saying.
Well, thank you very much, Brenda. It is another day when President Uhuru Kenyatta is expected to have a conversation, an update to give about the COVID-19 situation in the country. 1 month ago, when he let loose some of the measures, we've seen the numbers of COVID-19 cases increasing by 350%. That is very alarming, and we've seen political rallies, we've seen bars, flouting some of those reasons or some of those measures that were put to maintain or to contain the spread of this virus. And some Kenyans are speaking into this ahead of that address that we'll be expecting later on in the day. So I'm joined by one of them here. Kindly join us. Just tell us your name and what do you expect the president to do today now that we know that the numbers are skyrocketing in the country?
Okay, my name is Lynn. And in as much as the number is skyrocketing in the country, I wouldn't expect the president to close down the country like 100% because some of us, sisi, common mwananchi, we are really banking on so much. And when the country is closed like 100%, then tunalala njaa.
Okay. There are concerns about these political rallies. And many of those people have been attending those rallies without masks on, without social distancing. Do you think we should do something about that?
Yeah, definitely we should do something about that because I don't understand how this thing is supposed to work for just a number of people and then wengine wako sawa. Because for politicians, it looks like everything is okay. They do political rallies, there is no social distancing, hakuna story ya masks. But when it comes to us, tunaambiwa no gatherings, no I don't know what. I think hii number kuskyrocket sana imechangiwa sana na these political rallies because there are no measures being taken there and watu wanamingle tu kama kawaida.
Asante sana. Well, thank you very much. Brenda, we are going to speak to more Kenyans about this in our subsequent bulletins. But what is emerging right now is that Kenyans have been experiencing a lot of challenges after the economy was closed down for over 6 months before it was opened up a month ago. And these political rallies is what is becoming a big challenge because members of the public who attend them and even the politicians have been flouting these rules without utter disregard to the guidelines that were given by the Ministry of Health. And right now we are talking about 57,000 COVID-19 cases, over 1,000 deaths, and we're expecting that the president is going to act and, of course, just trying to do the balance, the delicate balancing of looking at the livelihoods and the lives of Kenyans. So that is, at this point, I take you back to studio.
All right, Emmanuel, too, thank you so much. Too, you also wait to see what the president will have to say about those political gatherings. So far, we know that Deputy President William Ruto has cancelled all his gatherings that he had planned for due to the high numbers of COVID-19 in the country. On that note, I take another commercial break.